Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I am Dr. Tathagata Datta, MCH Neurosurgery from Kolkata, West Bengal.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, the seizure, the term seizure, it means our brain uses tiny electrical signals to control everything we do. That is, when a person's brain is overloaded by an abnormal amount of abnormal electrical activity, not normal, then a convulsion or seizure occurs. During seizure, a person might lose consciousness, he might shake or even become confused, or he may even feel sudden fear or panic attacks.
What is epilepsy?
Now, epilepsy is a medical condition that is different. That is definition is which a medical condition with a neurological condition that causes a person to have repeated seizure. Typically, a doctor will diagnose epilepsy if someone has at least two unprovided or unprovoked seizure activities, meaning the seizures weren't caused by something else like a high fever or severe infection. There are different types of epilepsy, and while most people have only one type, some may have more than one type, complex epilepsies.
What are the different types of seizures and do they affect people differently?
Of course, there are various types of seizure. The most common one, as we all know, is the generalized clonic seizure, where there is shaking of the limbs, shaking of the whole body sometimes, and there are some other types of seizures where the absence seizures are called, where there is no movement of the body at all. The person just stares at some distant object and is unaware of his surroundings. It all depends on which part of the brain is involved and where the, as I said, abnormal electrical activity is originating from.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Very good question. It's not always that we know the cause of epilepsy. For about 50% of the adults with epilepsy, we may not find any specific cause. Some other causes for the other half, which may include most commonly head injuries, brain infections like meningitis or meningoencephalitis, sometimes large tumors or even small tumors, if affecting a specific brain area, can cause epilepsy. Stroke patients can have seizure activities. Alzheimer's disease can also can lead to epilepsy. In those patients who do not we need to do not find any cause, genetics sometimes play a role. There are some genetic factors, some specific genes we have identified, which make the person prone to having convulsive episodes.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Now, uh, epilepsy signs and symptoms, as I say, there are different types, and the symptoms also vary a lot. Most commonly, as I say, generalized tonic-clonic seizures, there is sudden convulsions or jerky movements of the body. The patient may lose consciousness, or in some kinds of seizures, there is only movement of specific part of the body, such as one limb, one finger, even twitching of the angle of the mouth. This is a sign of epilepsy. Sometimes the person, as I said, in absence seizures, the person may stare off into space or in a distant object, not unaware of the surroundings. So the caregiver should take into account that as there are various types of epilepsy, there are various symptoms of epilepsy also.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Uh, Unfortunately, epilepsy has been misunderstood for a very long time. Historically, people didn't realize that epilepsy is a neurological condition, and the various types of myths developed around it. A person suddenly moving his or her limbs can look frightening, so people may react to it in different ways. So, which leads to different kinds of stigma.
How does this stigma affect people with epilepsy?
Um, Individuals with epilepsy often face both social stigma, that's negative attitude, discrimination from others. These negative attitudes are reflected in reluctance to marry epilepsy patients, unwillingness to employ them in epilepsy patients, or even being in the same vicinity as them, as if they will contact the disease by even by living in the same room, and discouragement of of other children from playing with children with epilepsy. Research has shown that stigma can actually increase the frequency of seizures because stress is a very common trigger factor for epilepsy. That is why there is the community, the surrounding people, the support system must be good, must be informed, must be supportive.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Now, as I say, there are various types of epilepsy. The triggers vary from variety of persons, variety of many people experience some epilepsy triggers, which include flashing lights, most commonly high stressful jobs or high stress levels. Sometimes, if a chronic sleep deprivation may cause epilepsy, skipping meals or skipping certain foods may also cause epilepsy. Most importantly, if you miss a seizure medication, if you're taking a seizure medication, if you miss one or two doses, there is breakthrough seizures and the patient may have epilepsy. Uh, in some women during the menstrual cycle, hormonal changes have been shown to cause epilepsy. During childbirth also, child labor pain also, there is evidence of epilepsy due to the hormonal changes.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. Uh, at home, I always tell the patients to clear away from things which may cause them harm, such as sharp objects or cords or clutter. And you never know what may trigger the epilepsy or the convulsion. So it is advisable to pad sharp corners on tables. In kitchen, use non-breakable dishes and consider using and don't use them when alone, and don't use ovens and stoves when alone. Also, placing soft carpeting on the floor can reduce the injury risk. These precautions are very simple, but sometimes it may be life saving for the patient.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, I always tell my patients there are two prospects to epilepsy I like to highlight. First of all, epilepsy presents in a variety of ways. So, if someone is having an seizure attack or convulsive attacks, consult a local physician first and then take him or her to the hospital, local hospital, if referred. And don't go to some ojhas or like that for epilepsy management, because they will not be able to identify and will give wrong treatment first. Second is epilepsy or seizure, they are well managed by medications, and a person can live a happy social life, even marry, have jobs with epilepsy if proper medications are taken regularly. This is the first last slide I would like to mention. If you are having epilepsy, you must have a good support system, be it your parents, be it your spouse, be it your friends. You must have a good support system.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.